In this slideshow, we're going to talk about the importance of maintaining objectivity and accuracy when writing reports. So, what's so important about objectivity? Textbooks emphasize and re-emphasize the importance of being objective and accurate in documentation. And why is that? Take a minute and brainstorm. Why do you think objectivity is so important in the healthcare setting? Well, first of all, if you aren't objective, people will assume that you are biased, that what you say can't be trusted. They may think that you are withholding or embellishing. That means kind of exaggerating or adding to things to your advantage. Also, decisions are made based on the information supplied by the healthcare worker that's reporting. Therefore, that information must be trustworthy. Another thing is when someone's reading a report, it's important that they can tell the difference between what the writer of the report observes and what a patient or client actually said. So when writing, you need to distinguish that. That helps to make your report a bit more objective. Interpretations can be very vague and subjective and less trustworthy. Another thing about objectivity is that different people have different interpretations of events. A report should give the facts of the event rather than the healthcare worker's personal interpretation of that event. So as healthcare aides, we must be careful not to be biased towards our patients. Objectivity means to be looking at someone or something without bias. So what might be some of the consequences of submitting a biased report? Well, first of all, biased reports might be are unprofessional and you might be discredited. That is, people will not take your professional opinions seriously. Another consequence is just that the report might be rejected as unacceptable and you might have to rewrite it. And maybe worst of all, or most serious of all, when you use biased, especially negative bias language, that can bias other health professionals against a patient, and the patient may not receive the care that they deserve. So it's really important to maintain an objective tone in any type of medical documentation. You can do this by doing the following. First of all, record facts and avoid interpretations. Don't state emotional opinions. Instead of your opinions and your interpretation, record facts that are verified by your senses. That is, what did you see or hear or feel or smell? If you do give an interpretation, make sure you use qualifiers such as might or may or could or seems to be. Be sure to give the facts that support that interpretation. However, as a general rule, avoid interpretations. Let the reader make the interpretation. Secondly, avoid negative or biased language in your reports. Don't complain about the patient or your coworker. Don't criticize the patient or your coworker. Don't use unflattering or unprofessional adjectives or language. And don't even use overly positive adjectives. Don't make judgments, either negative or positive. Third, distinguish between hearsay and observation. This means distinguish between what you hear and what you observe. So use words such as stated, reported, and said to distinguish between what you hear and what you observed or what someone else might have stated. Use quotation marks to indicate another person's exact words. But if you use those quotation marks, be sure you only put that person's exact words inside those quotation marks. Now you should be ready to identify subjective language in a nursing report. Remember, record facts, avoid interpretations. Avoid negative or biased language. Distinguish between hearsay and observation.